Natural and home remedies for dissociative identity disorder. Dissociative identity disorder, DID, previously known as multiple personality disorder, MPD, is a mental disorder on the dissociative spectrum characterized by the appearance of at least two distinct and relatively enduring identities or dissociated personality states that alternately control a person's behavior, accompanied by memory impairment for important information not explained by ordinary forgetfulness. These symptoms are not accounted for by substance abuse, seizures, other medical conditions, nor by imaginative play in children. Diagnosis is often difficult as there is considerable comorbidity with other mental disorders. Malingering should be considered if there is possible financial or forensic gain, as well as factitious disorder if help-seeking behavior is prominent. DID is one of the most controversial psychiatric disorders, with no clear consensus on diagnostic criteria or treatment. Dissociative symptoms range from common lapses in attention, becoming distracted by something else, and daydreaming, to pathological dissociative disorders. Impact. Having a loved one who has DID can be painful, confusing, and may evoke all kinds of emotional reactions. If you become aware of the abuse, you may feel angry, anxious, sad, or disgusted, along with empathy and worry. It may be hard keeping track of all the personalities. Causes. The main cause of DID is believed to be severe and prolonged trauma experienced during childhood, including emotional, physical or sexual abuse. Recurrent episodes of severe physical, emotional or sexual abuse in childhood. Absence of safe and nurturing resources to overwhelming abuse or trauma. Ability to dissociate easily. Development of a coping style that helped during distress and the use of splitting as a survival skill. While abuse is frequently present, it cannot be assumed that family members were involved in the abuse. Symptoms. Many symptoms of DID are similar to those of other physical and mental disorders, including substance abuse, seizure disorder and post-traumatic stress disorder. The common symptoms of DID include inability to remember large parts of childhood, unexplained events and inability to be aware of them, frequent bouts of memory loss or lost time, sudden return of memories, as in a flashback and/or flashback to traumatic events, episodes of feeling disconnected or detached from one's body and thoughts, hallucinations, out-of-body experiences, suicide attempts or self-injury, differences in handwriting from time to time, changing levels of functioning, from highly effective to nearly disabled. Persons with DID may also have problems with depression or mood swings, anxiety, nervousness, panic attacks and phobias, flashbacks, reactions to stimuli or triggers, eating disorders, unexplained sleep problems, such as insomnia, night terrors, and sleepwalking, severe headaches or pain in other parts of the body, sexual dysfunction, including sexual addiction and avoidance. Treatment. Psychotherapy. Treatment for DID consists primarily of individual psychotherapy and can last for an average of 5 to 7 years in adults. Individual psychotherapy is the most widely used modality as opposed to family, group or couples therapy. Family therapy is recommended to help educate the family about DID and its causes, to understand the changes that can take place as the personality is being reintegrated, as well as help family members recognize symptoms of recurrence. Group therapy may be beneficial in addition to individual therapy, provided the group is exclusively for people with dissociative disorders. Persons with DID can sometimes have setbacks in mixed therapy groups because others may be bothered or disturbed by the personality switches. Clinical hypnosis. Despite controversy about therapists implanting false memories by suggestion, clinical hypnosis can be used in conjunction with psychotherapy when conducted safely by a trained therapist. Home remedies, herbs, and food supplements for dissociative identity disorder. Maca. Maca superfood has been used for thousands of years by native Andean populations as a staple food. It has high nutritional value, and also many medicinal uses. It is a great source of vitamins, minerals, fatty acids, amino acids, and sterols. There are different types of maca, including white, black, red, and yellow, all with different properties and benefits. The taste of maca root has been compared to chicory root or coffee, although it doesn't have any caffeine. Omega-3 fatty acids. Omega-3 fatty acids use provides health benefits for people with medical conditions such as depression, schizophrenia, prostate cancer, multiple sclerosis, macular degeneration. Fish oil. Fish oil use provides health benefits for people with medical conditions such as dandruff, heart disease, lupus, systemic lupus erythematosus, SLE, overweight, peripheral artery, vascular disease. Ginkgo biloba. Ginkgo biloba use provides health benefits for people with medical conditions such as intermittent claudication, peripheral artery, vascular disease, memory loss, schizophrenia, macular degeneration. Gotu-kola. Gotu-kola use provides health benefits for people with medical conditions such as cellulite, memory loss, Peyronie's disease, deep vein thrombosis, dementia. St. John's wort. St. John's wort use provides health benefits for people with medical conditions such as depression, obsessive-compulsive disorder, OCD, schizophrenia, bipolar disorder, borderline personality disorder, BPD. Flaxseed oil. Flaxseed oil use provides health benefits for people with medical conditions such as skin abrasions, cuts, scrapes, and abrasions, gastritis, anal fissure, indigestion. Valerian. Valerian use provides health benefits for people with medical conditions such as anxiety disorder, generalized anxiety disorder, insomnia, sleep disorder, borderline personality disorder, BPD, seizure disorders, epilepsy.